Warning: this video contains graphic images that some viewers may find disturbing. Viewer discretion is advised. On the 9th of October 2022, 24-year-old pregnant mother Gleice Kelly Gomez Silva was admitted to the Intermedical Women's Hospital in Jacarepaguá, Rio de Janeiro, Brazil, to deliver her third child. She was 39 weeks pregnant. On the 10th of October, her son had a normal, healthy delivery. The doctors then noticed that Gleice was bleeding internally, so needed to control the hemorrhage. An IV drip was placed into Gleice's left hand to deliver medication. To treat the postpartum hemorrhage, the medical staff used a Bakri balloon to reduce the bleeding. A Bakri balloon is a device made of silicone, which is connected to a 54 centimeter long silicone catheter. The balloon is inserted transvaginally or transabdominally into the uterus, then inflated so it takes the shape of the uterine cavity. Blood from inside the uterus drains into the central lumen of the catheter, thereby reducing or stopping the bleeding. Eventually, the doctors were able to control the internal bleeding. But at some point, the IV came out of Gleice's vein, and her hand started to swell and turn purple. The medical staff were so focused on stopping the hemorrhaging, they allegedly did not look into the reasons for her rapidly swelling hand. The Daily Mail reported that doctors said Gleice had developed signs of ischemia, which is a condition in which blood flow and oxygen are restricted or reduced in a part of the body. For Gleice, too little blood was getting to the limb. On the 11th of October, she was moved to another hospital in São Gonçalo, a hospital in the same network that owns Intermedical Women's Hospital. She was rushed to the ICU where attempts were made to save her hand. Gleice developed necrosis of the limb. Necrosis is a bacterial infection which enters the body, often by way of a minor cut or scrape, and can lead to death of the body's tissue when blood supply is cut off from a certain area. After the treatments failed, doctors said the only solution was to remove her hand and wrist, which they did on the 16th of October 2022. Gleice's issues with Intermedical Women's Hospital didn't end with the loss of her limb. In mid-December 2022, she had to return to the hospital as she had started hemorrhaging again. Doctors discovered that a part of the placenta was still inside her. She had to be admitted to have another surgery. The Daily Mail reported that Gleice had 10 prenatal consultations before giving birth, and no complications were spotted during the consultations or during the birth. During an interview with Globo News in Brazil, Gleice said, "After the birth, they claimed that I had a hemorrhage in the uterus, so they did the procedures and had to put in a venous line. I passed out, and when I woke up, I saw that the attack was bothering me, but I didn't realize that the hand was swollen. I just felt that it was sore and a little swollen. I was still in the delivery room and I fainted again because the first procedure didn't work and they had to do the maneuver again. I complained of pain and the hand was still swollen. Then I remember waking up in a corner of the pre-delivery room because I needed an ICU and there was none available there. And that's where it started. My hand swelling and access was only removed the next morning. They didn't give me any justification because the hospital transferred me without much documentation. So I'm after this answer. I don't understand much about this part of medicine, but I believe it was some mistake." Due to Gleice losing her hand, her 27-year-old husband had to quit his construction job so he could help with taking care of their 3 sons. Gleice also worries that she may not be able to return to her job as a cashier once her maternity leave ends. A lawsuit has been filed against the hospital. Gleice's lawyer, Mona Lisa Gagno, said, "They were so worried about the hemorrhaging that they didn't worry about the vascular access, which ended up leaving the vein and causing necrosis in her hand." At no time was there any explanation from them and the doctors who treated her about what happened to both the hemorrhage and the loss of her limb. There was no investigation. No one explained it to the family, neither at the time nor before the operation. On 16th of January 2023, Global received a statement from the hospital's legal team. Part of the statement read, The patient had a history of multiple pregnancies, including some complications, which increases the risk of postpartum hemorrhage in addition to gestational diabetes. The patient received assistance from all doctors, specialists, and necessary resources in an attempt to preserve the left arm. However, due to the irreversible worsening of the condition with venous thrombosis of muscular and subcutaneous veins, there was a need to opt for the amputation of the limb for the sake of the patient's life. For transparency reasons, the hospital reiterates its commitment to investigate with all seriousness, so has removed the leadership of the unit, but they are fully in solidarity with the victim and deeply regrets what happened. No matter what the medical staff or their attorneys say, Glace is now without her hand, which has greatly impacted her life. One has to wonder if all necessary precautions were taken before a doctor or nurse inserted the IV into Glace's hand. Hopefully, she will be compensated with enough money that will cover the care for herself and her family for many years to come.